Alrighty. Thank you for attending today's session. This should take about 60 minutes. Let's overview what we're going to do today. We'll take a look at the PDF that has been shared with you. And so here it is. I'll reduce the size of it so we can see there's more than 20 pages. I don't know that we'll be able to complete all of it today. We may finish some of it in the next session. There's one more session left and a final exam. So let's get started with the beginning part of this, which is a example or a sample exam that will look very similar to the actual exam that will be administered in this class. The actual exam will be 50 questions. It will look quite similar to the example that I'm going to share with you today. So we will get a variety of different forms of English here. And so you will see the first part will be TOEFL reading in a very simple reading. It will be a little bit more complex in the actual exam, but it will look just like this. So I'm going to give you time to read and select the best answers. I'll also read it to you so that we can experience and improve our listening skills. After that, a pronunciation practice, then IELTS listening, and practice IELTS exam. I've shared resources with you, and you can find these type of practice IELTS listening exams on YouTube. And then we'll take a look at some conditions and diseases, medical English, and the purpose will be to see how well we can listen and select the correct answers. So let's get started with page 1. And I'm going to ask you to read this in your PDF. You can see it on the screen, but if you open up the PDF, you should be able to read this. And I would like you to take 5 to 8 minutes to read this relatively simple reading and then answer the comprehension questions. I may not give you as much time as you should have for this. How much time should this take? You should actually give it about 8 minutes to read and probably about 10 minutes to answer the questions on part 1. Part 2, let us overview part 2. And that is example, doctor-patient conversation. So this is a test of, it is conversational English, but it's actually a reading part. Choose the most professional option. 1, 2, 3, 4, 5, 6, 7. We got about 8 of them. And then this is a writing situation, although it's done multiple choice because of this format of the exam. But you'll read the Thai part and then you'll translate it into English, selecting the best grammatically correct English. And then we'll go through some grammatical structure typical of the TOEIC, TOEIC test. and an answer key is provided, and then some explanation of the correct answers. So let's read this. Take 8 minutes to read this. I'm going to interrupt you, and I will actually read it out loud. So it will be a good test of your listening skills and also support you in proper pronunciation. So take time to read right now. All right, I'm going to interrupt you and I'm going to read this aloud so you'll get a sense of some natural English pronunciation of this relatively simplistic reading section. The actual TOEFL reading will be more complex than this. And our final exam for this course will be more difficult, but may not be quite as difficult as the actual TOEFL reading. Similar to TOEFL reading as IELTS, they're basically the same level. Simpler than that would be TOEIC. We'll take a look at a TOEIC part. So I'm gonna read this, and you may follow along with me. Title: Digital Mental Health in Clinical Practice. Over the past decade, digital mental health tools such as smartphone applications, online therapy platforms, and remote monitoring systems have become increasingly common in psychiatric care. These tools aim to improve access, reduce waiting times, and support patients between visits. For many people, especially those living far from specialized services, telepsychiatry offers a practical alternative to in-person appointments. Patients can speak to clinicians by video, complete symptom questionnaires at home, and receive follow-up reminders about medications or coping strategies. One major advantage of digital care is continuity. Traditional outpatient follow-up may occur every few weeks. leaving long gaps when symptoms can worsen unnoticed. Digital check-ins such as brief daily mood ratings or weekly anxiety scales can alert clinicians to early warning signs. For example, a steady drop in sleep duration combined with increased irritability might suggest relapse in a patient with mood disorder. When identified early, clinicians can adjust treatment, provide additional support, or recommend urgent evaluation, potentially preventing hospitalization. However, digital mental health also raises concerns. Privacy and data security are major issues because sensitive health information may be stored on third-party servers. Even when platforms claim to be secure, breaches can occur, and patients may not fully understand what data is being collected. Another challenge is clinical quality. Some apps provide evidence-based strategies, but others offer untested advice that may be misleading or inappropriate. Without careful selection and oversight, patients may rely on tools that do not match their diagnosis or level of risk. Digital media tools may also unintentionally worsen inequity. Patients with limited internet access, low digital literacy, or financial constraints may not benefit equally. Older adults, in particular, might struggle with complex interfaces. In addition, certain clinical situations still require face-to-face assessment, such as severe psychosis, high suicide risk, or cases where a detailed mental status examination is essential. Therefore, digital mental health works best as a supplement, not a replacement for comprehensive psychiatric care. In conclusion, digital mental health tools can strengthen access and monitoring, but they must be used responsibly. Clinicians should choose evidence-based platforms, explain privacy risks clearly, and ensure that digital services remain patient-centered. With proper safeguards, these tools can support safer, more continuous care while respecting individual needs and clinical judgment. Again, this is for reading, not really for listening. But I wanted to read it just to give you a sense of the medical English here. And it's a valuable thing that you can do to improve your speaking skills is simply reading texts like this aloud. And one simple way to test the accuracy of your pronunciation would be to open up a Google Doc app and turn on the microphone and do voice typing and see how accurate your English is. All right, let's get into the comprehension questions. So take 5 minutes to go through these answers, and then I'm going to give you the answers. Additionally, within this PDF is an answer key for all of the exercises. So take a few minutes to do as many of these as you can. All right, let's talk about the reading comprehension here. I'll give you another minute to review. Alrighty, let's talk comprehension. Let me adjust my camera here. It's a new setup, so bear with me, please. All right, let's see if we can make this straight and clear. Good. All right. What is the main purpose of this digital mental health? These digital mental health tools mentioned in the passage A, B, C, D, E. The best answer, B. Improve access and support between visits. Okay, this has been stressed multiple times in the reading. 2. What does the passage describe as practical benefits of telepsychiatry? A, it guarantees better outcomes than face-to-face care. B, it allows patients to avoid all clinic visits permanently. C, it helps patients living far from specialized services. D, it removes the need for medication. E, it prevents all relapses. Common sense here. C is our correct answer. It helps patients living far from specialized services. In the passage, continuity mainly refers to using the same medication forever, having frequent monitoring between appointments, making every visit longer, avoiding questionnaires, keeping treatment secret. Here, the best answer is B. Having frequent monitoring between appointments. 4. Which example is used as an early warning sign of relapse? Increased appetite, improved sleep, less irritability, and more energy. Lower sleep duration plus increased irritability. Fewer daily mood ratings, more clinical appointments. The best answer here, C, lower sleep duration plus increased irritability. 5. Which of the following is of a concern about digital mental health tools? A, they're always too expensive for hospitals. B, they cannot be used for anxiety disorders. C, privacy and data security may be a risk. D, they require no clinical involvement. E, they always cause hospitalization. The best answer, C, privacy and data security may be at risk. Let's continue. 6. What does the passage say about mental health apps? A. All apps are evidence-based. Some apps may offer untested or misleading advice. Apps are better than clinicians at diagnosis. I don't think so. Apps do not collect any data. Apps only work for older adults. The obvious best answer here is B. All right, this may be a little bit easier than our final exam and significantly easier than an actual TOEFL exam. It'd be a higher level than this. 7, according to the passage, digital tools may worsen inequity because they require inpatient admission. They exclude anyone under 18. Some patients lack access, skills, or money. They cannot be translated into other languages. They are illegal in most countries. Best answer 7C. 8. Which situation is given as still requiring face-to-face assessment? Mild stress before exams, stable insomnia without risk, high suicide risk, mild situational anxiety, routine follow-up with no symptoms. The best answer is C. 9. The passage suggests digital mental health should be A. a supplement to comprehensive care, B. a full replacement for psychiatry training, C. used only for medication refills, and D. avoided due to privacy concerns, E. limited to research studies only. Best answer here, 9, is A. The word safeguards in the conclusion most closely means decorations, delays, protections, arguments, shortcuts. The best answer here is C, protections. All right, medical interviews. Here's some example doctor-patient conversations. To ask about depressed mood, the focus here is psychiatry. And I know we don't have any I believe we do not have any psychiatry residents, but this is from a chapter of a book that I am writing, and the focus is on psychiatry. Last time we talked about pediatric medicine. Today our special focus will be on psychiatry. In psychiatry, the use of, when we talk about treating individuals in Thailand that are not able to speak and communicate in Thai language, English is going to be the most obvious foreign language that we would need to communicate with. The exception might be the other Asian languages, and especially Chinese, but English is still the number one language that is being utilized in medicine. So let us take a look at this. Let me fix my camera. It's not focusing. Okay, there we go. Choose the most professional option. 11. To ask about depressed mood, the best phrasing is A. Why are you sad? B. Have you been feeling down lately? C. You're depressed, right? D. Don't be negative. E. Are you weak? Some of these are pretty obvious. Okay. The best answer here is B. Have you been feeling down lately? Down. idiomatic meaning is it's synonymous, a synonym with feeling low or feeling depressed. Okay, and in medical terms, depressed. In the language of the patient, down. But patients certainly know the term depressed. Now, it's useful to note the language of the doctor and the patient. We're not going to get into it in a lot of detail today. There are many tools, including AI tools, that can clue you into some of the distinction between the language of the doctor and the language of the patient. An obvious example of this would be in an interview with a new patient. One of the questions we might ask is, "What's brought you along today? How may I help you?" These kinds of conversation starters in a clinical setting. In the language of the physician, it would be, "What is your chief complaint?" And this is quite strange and awkward. A patient would not really understand that type of language use unless they are a physician themselves. All right, let's continue. To assess sleep, the best question is A, you sleep okay? B, are you sleeping like a baby? C, do you have trouble sleeping? D, you should sleep more, right? E, are you lazy in the morning? Best answer here is C. Do you have trouble sleeping? And all of these situational uses of English can have variations. So there's not ever just one answer when we think about conversations in English in a medical situation in clinical settings. All right, let's continue. To explore panic symptoms, the best question is, do you ever freak out? Have you had any recent panic attacks? You're overreacting, aren't you? Why can't you control yourself? Are you dramatic? Okay, the most professional and polite question would be, have you had any recent panic attacks? Freak out is a idiomatic expression related to having difficulty dealing with current situation, but it's not professional. Interesting idiomatic slang term for psychiatry would be the term, do you know this term? Shrink. Not Shrek, shrink. See if we can get this on the screen. I'll write that down. SHRINK. And it is a relatively simplistic slang term for psychiatrist, not the language of a medical doctor, and a medical doctor would not be using this term, but a patient might. It's not really polite to refer to a psychiatrist as a shrink, but it's common in spoken English, at least in American English, which is my country. Okay, to check concentration professionally, can you focus or not? Do you find it hard to concentrate? Your brain is okay. That's not a good question. You're distracted because of your phone, right? You can't concentrate at all. Okay. Do Do you find it hard to concentrate? Best answer there. All right, we're going to move on. Well, let's see if we can complete this. 15. Suicide risk screening. You won't hurt yourself, right? Don't do anything stupid. Do you have thoughts of self-harm? You're not suicidal. You wouldn't dare hurt yourself. 15. C. 16. To ask about paranoia in a patient-friendly way. Paranoia. I think we all know the definition of paranoia. 16. Are you crazy? Have you felt paranoid about anything? People are chasing you, right? You're imagining things. Is your mind broken? Best answer, 16. B. To explore trauma reminders, what's your worst memory? Have you been avoiding situations that remind you of a bad memory? Stop thinking about the past. Trauma is common, so you have it right. Don't be sensitive. All right, B is obviously the best answer. Have you been avoiding situations that remind you of a bad memory? 18. Completing a visit with a clear plan by. Not very comprehensive visit. Take care of yourself. C. If your systems worsen or you feel unsafe, please come back urgently or go to the emergency department. Just relax more. E. You'll be fine. Obviously, the answer is C. Translation. The purpose of this exercise is writing and using Thai language, translating Thai into English. Let me just fix this. All right, 19. The font is really small. I'm not very good at reading Thai, so you should be able to read it. And you could, if you have the PDF, you got the PDF, so you can make it larger. So I'll just give you the correct answers for these translations. But we'll take a look at the grammar also. Are you angry with everyone lately? Have you felt anxious recently? Do you feel sleepy recently? Have you been confused recently? Are you hungry recently? The best translation of that would be B. Have you felt anxious recently? Number 20. I'm not going to read it because I can't really read it. Do you have trouble sleeping? Do you hate sleeping? Are you sleeping too much because you're lazy? Do you sleep only in the daytime? Can you stop sleeping? Obviously, the best translation would be A. Next one, and we've already reviewed this one. Have you been feeling down lately? Have you been feeling excited lately? Have you been feeling sick lately? Have you been feeling hungry lately? Have you been feeling angry lately? The best answer, 21, is A. 22, do you ever think other people will hurt you? Do you have thoughts of self-harm? Wait, let's go back. Yeah, here we go. Do you think you should punish yourself? Do you have headaches from stress? Do you want to sleep more? 22, the best answer is B. Have you felt paranoid about anything? Do you feel proud of yourself? Are you afraid of all people? Have you felt sleepy about anything? Do you feel jealous about anything? The best answer, have you felt paranoid about anything? 24. Do you avoid all social events because you dislike people? Have you been avoiding situations that remind you of a bad memory? Do you forget bad memories quickly? Do you enjoy remembering bad memories? I don't think so. Do you avoid hospitals because they are scary? Our best answer, B. All right, let's move on and finish. TOEIC, this is structure, grammar. Consultant. Now, this is an American test, but the term consultant would be normally used. It's more British English than American English in medicine, and it means specialist. So it's you people, medical residents, specialists. Fix this. Okay. All right, and this is just to identify the correct grammatical word form. The consultant recommended that the patient blank a follow-up appointment next week. Scheduling, schedules, schedule, scheduler. The correct answer is A. The clinic's new policy was designed to improve patient safety, safely, safer, safeness, obviously, safety, patient safety. The report was submitted on, in, at, by, for. Correct answer, 27D, by the deadline. However, I could see an argument for on the deadline, exactly on the time when it is due. The psychiatrist spoke blank so the patient could understand the plan clearly. The team discussed several treatment options and chose the most appropriately. The best answer is appropriate. Patients are encouraged to contact the clinic if symptoms worsening, worse. It's A, worsen. Sorry, we can't see it on the screen. There you go. Okay. Answer key is provided. And there is a little more detail that you could read about the correct answers. I've discussed that briefly, but you can see just a little bit more detail about that in the PDF on page 7, 8, and 9 that explain in a little more detail what the correct answers are. All right, let's move on to our next task, and that will be pronunciation. Let's go take a look at our... Alrighty, let's take a look at pronunciation, past tense. Regular verbs have 3 different pronunciations in the past tense, or the past participle. The difference is the sound that you use for the ending. This is a very useful exercise, especially in light of Thai speakers of English. Final sounds are sometimes a challenge, and it's easy to make mistakes. So let's take a look at this. It's a subtle difference between these final sounds. The first example is a T. You can't see it perfectly, but it's a T right there, a T sound. Example, placed. It sounds like it's spelled Plact, but it's an ED. And so, again, this common theme comes up that English is a challenge. It's not always pronounced the way it's written. So these all look alike with the ED, but they're pronounced differently. B, the D sound, examined. And the tongue is up against the palate. Examined. That's a D. And the third one, although you can't see it perfectly, I'm sorry it's not a great copy, but it is injected, like it's a ID. It is an additional syllable, injected. So let's go through these examples. See if I can open it up on my page. Yeah, let me fix this. And we'll go through these examples. Okay, the first, we're identifying them by A, B, C. So let's start with, sorry, let's get that into focus. Good. All right. She was, the first word is, yeah, let me highlight these words. And these are past tense verbs. I'll just highlight them and then we'll go through each one of them. All right, let's start with the first one, vaccinate. Is it A, B, or C? It is C, vaccinated, as if it was spelled ID, vaccinated. And that I will put a C, vaccinated. Now the V sound sometimes is problematic for some Thai speakers of English. Thai does not really have a V. And so it's important, if you can look at my mouth, you got to put your teeth over your lower lip and say vac, 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 a V sound. It is not wax. That's a W sound. So I think we all know that, but sometimes some of us might forget it. All right. Next one is diagnosed. That is A. It's a T sound, diagnosed. It's as if it was spelled with a T, but it's not. Okay. Next, improve. And that is improved. It's a D sound. That is B. Reduced. A. It's a T sound. Consulted. C. Recommended. That is C also. It's an id. Recommended. The patient coughed and sneezed. Coughed. A. T sound. sneezed. It's a D sound, so we'll mark that as a B. The surgeons replaced. That's A, replaced. Diseased. That's B, not C, it's B. It's not pronounced diseased, it's pronounced diseased, as if it was just a D, not an ED. The doctor, and now Prescribed, it's pronounced as if it was spelled P-E-R. We say prescribed. We don't really say, at least in American English, prescribed, but I wouldn't worry too much about that. And small mistakes in these final sounds are not significant and may not result in a failure to communicate, etc., etc. But pronunciation, proper pronunciation helps. There's many factors. This is simply one of them. All right, let's move on and see where we are here. Okay, that is prescribed. 8. The doctor's speedy action prevented C. Prescribed was B. The pharmacist mixed. It's a T sound. A. Chemicals in this bottle. The surgeon's pronunciation here with the O sound is not operated. It's operated. But we again, another example of written English. English from the spelling is not always easy to determine the pronunciation, because we have some words that are pronounced with an O, as in Ohio, okay, but here it's operated. All right, let's continue, and that is C, operated. Injured? No, it's injured. It's a D sound, and we mark that as B according to the models A, B, C. You can go home now, the doctor. You're cured. And cured, that's B, is sometimes mispronounced. For some reason, some Thai people have difficulty pronouncing that correctly. Cured, cure. Okay. The nurse disinfect, and this is obviously C, disinfected. And dressed. That's A, because it sounds like a T. She's being treated, C, by a heart specialist. The heartbeat is regulated, C, by the sinoatrial node. Hormones are released. That's A, released by the body, into the body by the glands. His pulse rate increased by 10%. The attack was preceded by a rise in body temperature. Surgical instruments must be sterilized. It's a D. Sterilized. The tongue is up against the up against the palate. D, not T. T is voiced. D is a different sound. Nobody noticed. Okay, that's B. Excuse me, A. Noticed. It's a voiced T sound. The pressure had dropped. And that is another T sound, or we mark that as A. The surgeon probed. Best answer, B. All right, and that is pronunciation in the past tense. All right, now it's time to do a short sample of an IELTS practice exam. You can find these on YouTube. I've shared these resources with you, and if you go back to the documents I've shared in the first week, you'll see the links for these resources that I have uploaded to Google Drive. So let's play the tape and make sure our sound is working correctly. So let's get started. And it gives instructions on typical IELTS listening exam. So let's check our sound and let's roll the tape. All right. Now this is not produced by IELTS, but it is produced by individuals who are simulating these exams. So let's get started. There's a little music to begin.
About her membership of the club.
Wait, let's go
First,
back.
you
Sorry.
have some... About her membership of the club. First, you have some time to look at questions 1 to...
All right. This is IELTS listening, simple test of listening skills. And there may be a few spelling errors in this example, but it's relatively accurate. No more than 2 words and or a number. This will only be played once, so you got to listen carefully to select the correct answers. Let us begin. There's 10 or 20 questions here. Let's see how many we can do.
5. Now we shall begin. You should answer the questions as you listen, because you will not hear the recording a second time. Listen carefully and answer questions 1 to 5.
Oh, excuse me. I wonder if you'd have the time to take part in some market research.
What's it about?
About this club and your experiences and opinions about being a member. It'll take less than 5 minutes.
Oh, okay then, as long as it's quick.
Can I start by taking your name?
It's Selina Thompson.
Is that Thompson?
Yes.
Okay, great. Thanks. And what do you do for a living?
Well, I'm an accountant, but I'm between jobs at the moment.
I understand. But that's the job I'll put down on the form. And would you mind my asking which age group you fall into? Below 30, 31 to 50, and above?
Over 50, I think we can safely say.
Great, thanks. And which type of membership do you have?
Sorry, I'm not sure what you mean. Do you mean how long?
No, is it a single-person membership?
Oh, right, no, it's a family membership.
Thanks. And how long have you been a member?
Ooh, let me see. I was certainly here 5 years ago, and it was probably 2 to 3 years more than that.
Shall I put down 8?
Oh, I remember now. It's 9, definitely. Sorry.
No problem. I've got that. And the last question in this first part is, what brought you to the club?
Sorry?
How did you find out about the club? Did you see any ads?
Well, I did actually, but I have to say I wasn't really attracted to the club because of that. It was through word of mouth.
So you were recommended by a friend?
Actually, my doctor. I'd been suffering from high blood pressure, and he said the club was very supportive of people with that condition, so I signed up.
Great, thanks.
Before you hear the rest of the conversation, you have some time to look at questions 6 to 10. Now listen and answer questions 6 to 10.
Now, for the second part of the form, I want to ask a bit more about your experience of the club.
Sure.
How often would you say you use the club?
It varies enormously, depending on how busy I am.
Of course. But on average, per month?
I'd say it averages out at twice a week.
Okay, so 8 on average.
Yeah, and 4 of those are aqua aerobics classes.
That leads me to the next question. Would you say the swimming pool is the facility you make most use of?
Fair to say that, yep.
Right, thanks. And are there any facilities you don't use?
One area I realise I've never used is the tennis courts. And there's one simple reason for that.
You don't play tennis?
Actually, I'm not bad at it.
Oh.
It's that I'm not happy having to pay extra for that privilege.
Ah, right. I've made a note of that. Thanks. Now, in the last section, are there any suggestions or recommendations you have for improvements to the club?
Only about health and fitness?
Anything at all?
Well, I'd like to see more social events.
Ah.
It isn't just a question of getting together for games or classes, but other things, you know.
Yes, sure.
And another thing that I was thinking when I had my yoga class in the gym last night, we were all sweltering in the heat, was that I think they should put in, or, you know...
Air conditioning.
That's exactly what I mean. The rooms are really light and well designed, but they do need proper installations.
Sure. Well, I've made a note of that.
Good.
So, is there anything else you'd like to suggest? About quality of service, for example?
Oh, everyone's very nice here. They couldn't be more friendly and helpful. Oh, but I tell you what, it's a shame the restaurant isn't open in the evening on Saturday, and Sunday as well, for that matter.
Oh. So, the club should...
Open it later on those days.
OK. Well, thank you very much. That's all the questions I have.
Alrighty then, we're going to then review the answers for these first 10 questions, and looks like we'll conclude. So let's go back, and these IELTS exams do just that. They also give you an equivalent score of what it might translate into a real IELTS score. Alright, let's go back. You can see this in the PDF, but I'll do it on the video right there. Okay, let me show you on the screen here. Let's see if we can set that up. Yeah, let's go through the answers here. Okay. All right, the challenge is that the tape is only played once, so you got to listen carefully and select the best answers. So we got her name, but the question is, what is the occupation? The correct answer is accountant. Excuse me. Accountant. Age group, she admits to being over 50. 2 words, over 50 years old. Type of membership, family. Length of the membership, she's been a member for 9 years. She, recommendation, not a friend, but the doctor made the recommendation for this membership club. All right. Facility that used the most by this individual would be the swimming pool. Swimming pool. One or two words is correct. And facility not used is the tennis courts. She doesn't like it because they want money. They want her to pay extra, and she doesn't agree with that. Suggestions: have more social events. Install. Sometimes it gets stuffy, hot. Air conditioning. And finally, she thinks that something should be open on the weekend. 1 or 2 words. The or restaurant. Restaurant. And that is an example of an IELTS exam. And I believe that it's quite similar to the real IELTS. Let me fix my camera here, and we're going to shut it down. All right. This class will continue for 1 hour session next week, and then we have a final exam that is quite similar to what I've already shared with you. So it's in the PDF. And so to answer your question of what's the exam going to be like, go through the exam that I've shared with you. It'll be slightly more challenging, and the real exams are more challenging than the exam the practice exam and then the actual 50 question exam that will be administered at the end of this short course. But the real exams, be it a reading TOEFL exam, will be more challenging. IELTS will be very similar to what we shared with you today. So thank you for listening. We'll see you next time. Stay happy and healthy. Bye-bye.